needed now to fix it once and for all?
And yes, today we are joined by two incredible guests. So we have award-winning journalist Melissa Sigodo telling the stories mainstream media ignores, and Michaela Ford, also known as Red Medusa, a poet and researcher challenging the system shaping Black women's maternal health.
Wonderful. Really excited to have both of these amazing women joining us today. And it's great to see that all our technology is working fine today so far as well. Fingers crossed. So there's been lots going on at the moment. I would say it was really interesting about the march, the anti-racism march, I think, at the weekend, because so much of that impacts Black women in terms of what's happening at the moment in the UK. But something specifically about our health was the health secretary, Wes
Mm,
Streeting, had an announcement last week about the changes to the NHS. And one of the things that he talked about was focusing on tackling health inequalities and what he described as medical misogyny. And I really think that that recognition matters because too many women are affected by not being listened to in the health system. But I think it's really important that we remember that not all women have the same experiences in the health system. And Black women in particular are much more likely not to be believed, not listened to, not having our symptoms taken seriously, and very
mhm.
that leads to worse health outcomes. And this is something that's been affecting us for generations. So I think not just misogyny, but we need to be thinking about misogynoir in the health system. And Vanessa, as both a doctor working in the NHS and a Black woman, how do you feel about it?
No, thank you, Susan. And, yes, hearing the words medical misogyny from the Secretary of State for Health, it matters. And I think language from that platform carries weight, and acknowledgement is definitely, a necessary first step. But, being completely honest, acknowledgement without, disaggregation isn't enough. So, when as it completely as you say, when we talk about women not being listened to, not being believed, we've got to also be willing to name those that bear the heaviest burden of that. And the data's clear that Black women are more likely in the UK to have their pain dismissed, etc. And we see it in maternal mortality. And also, as you said, I live this duality every single day as an NHS consultant on one side in the consultation room, and then as a Black woman, I'm acutely aware that if I walked into many of those same rooms as a patient, my experience could look very different. So I think I believe recognition is a start, but we certainly can't let it be the ceiling of what needs to be done. Yeah.
Absolutely. And it's not just in terms of the health system that Black women aren't listened to and our stories aren't amplified. It's certainly something that we are seeing in the media. So I'm very excited to be bringing on our first guest, Melissa.
Hello, thank you so
Hello.
Hey.
Yay. Wonderful to have you on. For people who do not know Melissa, she's an award-winning journalist and founder of the Black community news platform, The Source. She's previously worked for a national newspaper before launching her own independent platform, which has broken major stories and is holding power to account. So welcome, Melissa.
Thank you so much. Thank you so much for having me to talk about this really, really important issue. Thank you.
Wonderful. And Melissa, you've been highlighting stories of Black women going missing for some time now that's being widely ignored by mainstream media. What would you say is like when it comes to whose stories are told, who's not actually being listened to and what's not actually being covered in the mainstream media at the moment?
You know what? It's so sad. Like you mentioning the Black women who have gone missing, and the most recent case, Edna Mbako, a Kenyan student who was found dead in a body of water in Raysbury. That was, I know that people were absolutely devastated by hearing that news, not only because a young woman has been found dead, but the fact that she was missing for so long and nobody knew. For 6 weeks, she was missing. So when you think like, okay, how are we how are we being informed about these issues? Because I think that women want to help. They want to join in the search to find, a missing Black woman. They want to amplify the appeals. They want to help. When you don't even know it's happening because the media isn't even reporting on it, it's a double blow because now the media ignored this woman and now she's been found dead. So it just compounds that sort of devastation at being overlooked in mainstream media, of Black women being overlooked. And I mean, I don't think that those are the only issues. I think that there are intersecting issues, whether it's Black, disabled, LGBTQ women who are being overlooked. I think that it's across the board. As long as the color of your skin is a darker shade, then you're going to find that there's less of a desire to report on the issues that affect you.
Very true.
So true. And just leading on from that, can you tell us about the source and really what led you to start it, focusing on stories about Black communities?
I wish I could tell you the full story. I really wish I could. I wish I could. Maybe one day. But the basic premise was that okay, I'll start here. I was on maternity leave in 2023, I believe it was. And yeah, actually, it was 2023 to 2024. I was on maternity leave. And I love my job. I love reporting. I love journalism. So while I was out of the game, obviously I'm online and I'm looking at every story that's coming out. And I remember being on maternity leave, I saw one story about a mum, a Zimbabwean mum who was a care worker, and she wasn't allowed to bring her child to the UK because of the immigration laws that we now see are becoming more and more restrictive. So she wasn't able to bring her child to the UK. And the reason the Home Office also told her she couldn't do that, they said that there was no reason for the child to be brought to the UK. And it was like, how about the reason is to be with their mother? How about that? Is that not a good enough reason? And I saw this story, it was in The Guardian, and I just felt like, okay, this is such an important story. Why are we not talking about this? This is outrageous, in my opinion. And, because I'd stepped away, because I was on maternity leave, it gave me an opportunity to actually look more at other journalism that was out there, instead of just focusing on what I was writing. And so I was seeing more and more stories that I felt like, guys, how is this not a top story? How are we not, looking at this? Why aren't we caring that, Black women are being separated from their children? Why are we not caring that a Black woman died pregnant in hospital because of cultural bias? Why isn't this front page news that these things are happening? So the source was born out of initially just going through the mainstream news and collating the stories I felt that people should know about. So it was like a weekly recap into all these stories so that people could actually know, okay, this is what you missed. These are the important stories that didn't make the headlines. And then it evolved into me actually doing on the ground reporting independently and writing stories from the Black community. Because I said, you know what, I left the national paper that I was at, and that's when I decided to start writing my own stories and bringing those forward. And yeah, since then, I feel like we're covering important issues. I think that the Black community is completely overlooked, and that lends itself to gaslighting us and making us feel that our stories aren't worthy, or the issues that we go through aren't of value, or aren't, that they don't impact us as much as they do. So, and health is one of those things, you know, the gaslighting starts in the hospital, but it also permeates through the media, because when you don't even see the stories of what's going on, what's happening to us, it makes people feel like, okay, what's happening to me isn't really real, or it's not serious enough to be dealt with the way that it needs to be. That's
absolutely. Yeah, no, I absolutely agree with you. And that's very much the case, just in relation to the gaslighting that we so regularly face. And then also feeling that we're alone, that it's just happening to us. And that's why I think the source is so important, because so many of your stories, I think, actually, yes, that's happened to me, or that's happened to somebody that I know, and it's so powerful and it's so important. So thank you. You're really shaking things up with that. And we were having a chat last week about being founders, like so which is obviously like in relation to you founding the source, and then for Vanessa and me being founders of Phoenix Health Movement. There's certainly lots of positives, but there are also challenges. What would you say can be the impact on our well-being, and what can we do as Black women founders to take better care of ourselves?
I think that being a Black female founder is challenging because, you know, in society, we're overlooked as it is. So when you want to step out and be independent and show people what you can do on your own and what your strengths are and what you can achieve, you tend to get a lot of disrespect and disregard, because people feel like, oh, we're not going to take you seriously. Come on. Because, I mean, that's a place dominated by white men, white straight men. So when you want to step on the scene, it's like, no, girl, no. Yeah. So I think last year, that was really difficult for me, because I faced that a lot. And not only from white men, to be fair, but I faced it across the board. I think that you can face it from your peers, you can face it from Black men, you can face it from white men, you face it across the board, because there is that misogynoir. And then there is also that competitiveness, and there can be, you know, jealousy. There can be all sorts of things that just amalgamate together and make your life a living hell. But what I realized in order to deal with that was that focus on you. Focus on what you're doing. Don't look here and there and everywhere. Focus on what you're doing, because there's only one you, and what you do is important. It's special. People might want to negate what your impact is, but you're making an impact. So focus on you, and honestly, enjoy the ride. Enjoy the ride. I feel like it's not. I feel like sometimes it can feel like you're going towards a goal and just want to get there, but it's like, no, this is like long term. This is long term. This is not like a show that's going to end in December. Like, you want to do this for the long haul. So you might as well enjoy the ride, the ups and the downs, you know, all the pitfalls, all the highs and lows, all of it. Just enjoy it and take it in and appreciate your wins. I started a YouTube channel vlogging about being a founder. I started that 2 weeks ago. I got 1 subscriber the other day. I was overjoyed. I was like, oh my God, 1 subscriber. I feel like writing down those little wins, as small as they are, like, it does something to your mindset. It makes you realize, like, you know what? I'm focusing on all the things that are going wrong, but look, here's something great that happens, you know? So yeah, that would be my advice, to try and meet other women like you two, you know, who are wanting to build community and want to uplift each other. I think finding people who want to do that is also really important.
Wonderful.
Oh, you know, I love your honesty and your rawness. There's going to be so many people relating, because that 1 subscriber can, you know, take you from having no subscribers to 1 subscriber, and it's powerful. And we never, you're so right. We never really appreciate the wins. So no, thank you. And Melissa, I just wanted to ask you, because this is something quite personal. But you know, we're now seeing real tangible impact from your reporting, and you know, and including the reopening of the sickle cell unit at the Royal London. And you know, what does that show to you about the power of telling these stories?
Oh my gosh, I feel like, and this is why I wanted to write and produce independent journalism for The Source, because I know what the Black community is capable of. I know that there are people within the community who are really, really working hard to make incredible things happen, but because mainstream media is not geared to talking to them, to going into the community and actually finding out what people are doing, so we don't get to amplify that. We don't get to really bring it forward and go, look, somebody started a petition to save this sickle cell unit, and loads of people are behind them. If nobody's reporting on that, then that doesn't put pressure on hospitals to take notice. It just stays in its little bubble. Of course, social media plays a role, but you also do need journalists asking questions and highlighting the extent of what the impact or the loss of somewhere like the sickle cell unit can be. So it's really rewarding to do that. I'm grateful that people spoke to me, but ultimately I think it's the coming together of the Black community and also reporting on that combination can really do incredible things, I think.
Right. Thank you. Thank you. Oh, what a wonderful conversation.
Thank you. Thank you so much, Melissa.
Let me stay.
Love it.
I'd love to
come back.
Yeah.
You have to have you back. Good. And good luck with your little one.
Thank you so much. Thank you so much. But yes, I hope to come back again. And
yes, we would love to have you back.
Thank you for having this platform to even discuss this. That's incredible.
Wonderful.
Thank you.
So much. Thanks very much,
Thank
Melissa.
You so much.
Bye.
Take care.
Bye-bye.
That's just so powerful, and I love to see, you know, like Black women stepping up and actually bringing about real and meaningful change.
Completely. It's so inspiring. Really, it's really beautiful to hear.
And talking about Black women bringing about change, Vanessa, you've been all over the country in a roadshow for the manifesto. So what are you actually hearing from Black women around the country with regards to their health?
No, yes. So with the Black Women's Health Manifesto, which is a initiative that's been co-led by myself and Professor Jenny Douglas and coordinated by Christina Ganatakis, we went to Glasgow and Edinburgh, and it was fantastic. So thank you to everyone that received us in Scotland last week. But the conversations just really stay with you, and what you hear consistently across, you know, different cities, different generations and backgrounds is there is a feeling as well of kind of this exhausted vigilance, you know, that people feel that they're having to work hard in so many different ways, and particularly in healthcare. There's a lot of emotional tax on engaging with healthcare that comes with being a Black woman. But also we had a lot of reflections about you know, a lot of women feeling tired in terms of having to fight to be believed and over explaining, and it wasn't really isolated bad experiences. It was quite a pattern. So it hit hard, but it also hit home about the work that we're doing and why we're doing it. And we're going to Dublin in coming months as well, just to make sure that we expand our understanding. So watch this space, but lots more to learn.
Fantastic. Wonderful. And so shall we bring on our next guest?
We should, and I'm really looking forward to this because it really builds on the conversations that we've been having with about the manifesto. And I'm so pleased to bring on Michaela Ford, who is also known as Red Medusa, a poet, a researcher, and a LIS DTP PhD candidate at the Queen Mary University of London. And Michaela's work, which she'll go into, really combines poetry and public health to explore Black women's mental health, and she's a strong advocate for decolonizing research to address and dismantle the ongoing harms within public health policy, research, and dialogue. So, Michaela, you are so welcome.
Hi, Susan. Hi, Vanessa. It's lovely.
Hi, Michaela.
This is very exciting for us. But Michaela, I'm going to jump in with the first question and just reflecting about knowledge. And, you know, whose knowledge counts in research and policy making? And what are the consequences when Black women's voices are left out from your experience?
It's an excellent question because it really does tie into what we were speaking about with Melissa earlier with regards to whose stories get told. Who gets the permission to tell those stories, right? So in research, you find traditionally research methods are positivist, they're white, they're patriarchal, right? They are expected to be measurable, removed from lived experience, and completely detached, aka objective. Yeah. And then when you look at Black women's knowledge, it's often embodied, it's relational, it's communal, it comes from experience. And oftentimes this experience, it's expressed through creative methods, song, dance, poetry, quilting, artwork, right? You see these methodologies in places where you have mental health institutions and they'll get art therapists in, right? Or they'll get someone to come and play guitar for 10 minutes and have everyone singing along because it increases dopamine levels. We see that, but when it's authored and produced by Black women, it's dismissed. And so as a result of that, and you know, that is what we call epistemic violence, right? It's when knowledge is wiped off and it's ignored and it's not considered as knowledge, so therefore it doesn't technically exist, which means our voices don't exist, which means when women have a mental health crisis, and Black women who suffer with the highest rates of anxiety and depression, who are more likely to be sectioned and less likely to access mental health services, when we say we're having a crisis, no one's listening because we say our crises looks like this, it sounds like that. And the mental health institutions and health in general will say, well, you're not presenting in a measurable way, not presenting in a way that aligns with what we understand to be symptomatic of depression, anxiety. And then you layer that with something like the strong Black woman schema, where we mask and we say we're fine, and you know, and then we die, right? We die. We've got increased levels of suicide amongst Black women. And then you see the government has stopped measuring ethnicity along the lines of mental health. So now, and that was in 2014, right? So that in itself is a form of epistemic violence, because now we don't know who's dying, at what volume, we don't know why. We just know that things are getting worse, that Black women are increasingly suffering, and there are no measures, there's nothing there to say what that looks like. So no one's getting the help that they need, right? That's what it looks like. It looks like an increase in mortality. It looks like mental health crises. It looks like seeing ordinary Black women walking the street in a real state. And I see it all the time in South London, and not getting the help they need because nobody sees them. That's what it looks like.
Yeah, that's so true, Michaela. Thank you so much for sharing that. And also it's the fact that, you know, Black women, it's understandable why we're often reluctant to seek help, because, you know, we are dismissed, the fact that we're more likely to be sectioned, less likely to be offered talking therapies. All of this impacts on us seeking help or not getting help, and it just spirals. And this is something that's been going on for generations. So I'm so glad that you are doing this work and highlighting the violence that's being impacted on us as Black women in the mental health services. I just wanted to go on to ask you about, how do you respond to skeptics in the health establishment who see creativity in healthcare as soft or unscientific?
I mean, the word scientific is a loaded term, right? Again, who gets to determine what's scientific and what's not? Science in the Western hemisphere, and I use the word Western very cautiously, but scientists in this context, again, are white men. And again, when you reduce knowledge and knowledge production to such a narrow field, things like lived experience are excluded. When you're counting, lived experience doesn't count for anything. When I look at my research, which looked at how Black women use poetry to navigate their mental health, what the data shows, what their stories told me, is that they were able to communicate what their anxiety felt like, what grief did to them, the ongoing impact of weathering, racialized stress. And obtaining that information was a very rigorous process. So the poems that they wrote about their experiences were co-constructed from data that was taken from thematic analysis. I took their interview transcripts, and we took sentences and words and phrases from that and created poetry, which they had full ownership of. They could edit it, they could do whatever they liked, but the bottom line was it communicated their lived experience. They co-edited and validated their own poems. And the poems were also analyzed along, with the traditional kind of thematic to see where the nuance was and to see where the connections were, right? So it gave a really rich and in-depth view of the lived realities of Black women who use this medium in the absence of culturally competent, relevant, and necessary mental health care. So for me, I think the question is less about the validity of it on white patriarchal normative scientific lines. And the question needs to be about why our current systems are not equipped to recognize knowledge that falls outside of those heteronormative, hegemonic norms.
Gosh, you put it just perfectly. And as someone working in the research and completely about who dictates and what knowledge is created and what people perceive as science, can be really, really painful and frustrating. But you talk so beautifully about your work, and I can't wait to read it. And what did you discover about how poetry functioned as a coping mechanism during COVID lockdowns? And what does it reveal about gaps in formal mental health care?
I mean, it was, we covered 3 time periods with the research. We covered, early childhood, young adulthood. We covered poetry use during COVID and following COVID. The vast majority of the women in my cohort, whether they started writing poetry as young people or during COVID, was that poetry saved their life, right?
Gosh.
I had poets who went to their GP and said, I need help. I need someone to talk to. I need time off from work because I am drowning in what I'm going through. And their GP completely dismissed them. You're exaggerating. You're what's the word? You're hysterical, right? And the word hysterical, the root means from the womb. The word itself denotes an illness invented because it comes from the womb. It's biologically determined. And this is what these sisters were being told by their GPs. They told me, had they not had access to online communities, had they not discovered these places during COVID, they might not be here today. So they use poetry to process their emotions in real time, to make sense of the ongoing Black death that we saw during COVID, the trauma that came from seeing Black people being killed by the state and watching their own friends and families being taken out by the virus, which we were most susceptible to. They were able to document their experiences when they weren't seen by family, by friends, by their male partners, right, who had these gendered expectations from them, whether that was during, before, or after COVID. And they used it, this is the thing that really sings to me, they used it to build community. They used poetry to find other women who could say, I see you. What you're going through is not, you're not on your own. We can support each other. We can listen to each other's work. We can validate each other's experiences. It created a space that isn't available in formal mental health care. It's just not there. It's not there. And many of these women weren't accessing mental health care because of stigma. As you said, Susan, there's a plethora of reasons why we don't go to the GP. Distrust, lack of culturally responsive care, existing services didn't meet their needs in ways that felt safe, accessible, or affirming. And support was, the support they found was peer-led, it was creative, and it was community-based. So poetry during COVID in particular filled the gaps that healthcare wasn't, if it met a need that wasn't being met by mental health care. And it shows that we already have our own ways and tools for self-care and looking after ourselves, but institutions, rather than adapt, absorb, and learn from our practices, they ignore those practices. And that's what my research has shown me so far.
So powerful.
Amazing. Yeah.
We're running out of time, but I just want to very quickly ask you, Michaela, what would you want a Black woman listening right now, perhaps who's struggling quietly, to take away from this conversation?
I want them to know that many of us were raised in environments where creativity was a thing, right? I grew up in a sound system family. I heard lyrics, I heard jungle, I heard dancehall, I heard reggae, I heard ska, all sorts of things. I was raised amongst people that wrote and read books. All of us have something within us that's creative, that feeds us, that holds us, that nurtures us. I would encourage them to tap into that. I would encourage them to not dismiss their creativity as something that's a hobby or a pastime. Audre Lorde said that poetry is not a luxury, but it produces the light from which we cobble our hopes and dreams, right? And makes our realities possible. It makes futures. We can imagine our futures through our creativity, and we can reimagine an otherwise that can become real, and we make that real in community. So I'd like them to know that they're not alone, that there are other women around who have found ways to express how we feel and be heard. And that people like myself, like you, Susan, like you, Vanessa, like Melissa, are actively building forms of care and connection outside of the systems that don't hold us. We are doing the work for you, for those that aren't able to do it for themselves. And just be reassured by that.
Oh, gosh.
Wonderful. Thank you so much, Michaela.
Thank you. Amazing.
Thank you so much.
Thank you. Amazing.
I am coming back.
Yeah, we want you back. Want you back.
You've got
I will
to.
be
You've got
back.
to.
Yeah, wonderful.
Thank you so
Vanessa,
much.
with the Black Women's Health Manifesto. I was there with you in London.
Yeah.
I mentioned creativity in health and in tech, in relation to COVID, and how we build in fallback structures and ways of coping were COVID to come back. So I know that was valuable, and yeah, I look forward to working with you and communicating with you again soon. Say hi.
Wonderful.
Thank you so much, Michaela. And same for us as well. I appreciate you. Bye-bye.
Gorgeous.
Bye.
Thank you.
Wow.
And hi. And unfortunately, we have run out of time. Before we go, I want to say a big hello to my mum Rita, who's watching from hospital at the moment with my aunt Rita. Hope you'll be out soon, Mum. I'm rushing over now to come and join you.
Sending love from us all.
Yes. And yeah, all the time I'm dropping in all the time in all conversations. Also, my business partner, who's a consultant at Bart all the time. So yeah, Vanessa's feeding in all the time to my mum's. to my mum's care. But I'd like to say a huge thank you to everyone for listening to us today.
It's been amazing, and I got shivers just listening to our guests. So thank you so much, Melissa and Michaela, and thank you to Disruptive Live for supporting the broadcast.
And do please subscribe to our YouTube channel. Also subscribe to Melissa's YouTube channel. And we'll be back in about 6 weeks for the next episode of Rooted and Rising. Thanks again for joining us. Bye.
Thank you so much. Bye-bye.